first item on this agenda is mandatory vaccinations. This is specifically for care homes. So how this will work is that we will ask a series of questions, but also ask you if you've got questions that you need clarification on. So the first item with mandatory vaccinations, if you have a question, I'm sure most of you by now know where the hand sign is. If you don't, there's different ways of attracting our attention. You can wave at us, put your video on and wave at us, or you can put your question in the chat box, and myself and Megan will monitor the chat box to pick up the questions, and then they'll look to the people that are on the call to answer them. Raj, you've got your hand up already. Come in, Raj.
Hi there. Yeah, I had a question about the mandatory vaccinations. I've been trying to look online and I can't find the information. So basically, any new starter now has to have had their first vaccination and their second due by the November date, and that's fine, so they can start. Now, what about if you recruit somebody from overseas and they've had a different set of vaccinations from their country of origin? How is that acceptable? And you know, is it going to be allowed by whoever is sort of governing this? If it's a totally different vaccination from those offered in the UK?
Sure. So that's been picked up in the latest self-certification information that's come up. Megan, I think you can pop that in the chat box, can't you?
Yeah, I will. I'm doing that now. I'm just wrestling with a cat. I'll pop that in now.
So under that self-certification scheme, Raj, it does talk about vaccinations from countries other than the UK in there. So there's a period of time where there is an allowance for variations and so on. So it's picked up in there, I think. I don't know if anybody else on the call, let me just see who's on the call here. Any of the team from the quality improvement team?
Cheryl's got her hand up.
Cheryl.
Yes, I was just going to say that, Christine, that's exactly right, and it is in the guidance there, and there will be the self-certificates will be available for people to do that, and there is that one included for people who've been vaccinated in a different country.
Yeah, thank you very much. Thank you. So that's where it will be, Raj. I know it's a task to try to navigate your way around all the different pieces of guidance, and they are coming out ad hoc as well. What we don't know, Raj, is the length of time that self-certification process will extend to, and what other information might precede it. So we need to keep an eye on that, but that's as it stands at the moment, and I hope that would be helpful for you.
Great, thank you.
Brilliant. Okay, so has anybody else got any other questions around this mandatory vaccinations at the moment? Because certainly the 16th of September was the date which was given for the first vaccination to have been received, and the 11th of November for double vaccinations in care homes. So have we got anybody on the call today that's got any queries around that, or anything in terms of the guidance that they're not really certain about? Have we got anybody here from a care home? Let me just see.
Feel free to pop anything in the chat as well, or give us a wave. Oh, Raj has got his hand up.
Raj, yeah, no, come in, Raj.
I don't want to hog your stage or whatever. We've got a couple of people that are expecting and have refused to take the vaccination, and have we've given them the sort of guidance on the self-certification thing, and they've gone to their GP, and basically their GP has signed them off as being pregnant. Now, I didn't think pregnancy was an illness, but or required a sick note, but I could be wrong because I'm not an expert. in any way.
Okay, so yeah, Raj, this is what's really, really challenging. So we've done a lot of work to promote the vaccination through pregnancy, and there's a lot of research, a lot of data. We provided lots of information. Our last Q&A session, we had GPs, we had public health there. We got a webinar from midwives at the James Paget Hospital, which really promoted vaccinations during pregnancy. Obviously, there are exceptions to that. If there's high blood pressure or complications with the pregnancy, you'd speak to your GP. You'd have a discussion with your GP when you went to have the vaccination. However, in the latest self-certification information that's come out from the government, it puts pregnancy as one of those that you could use as a temporary break for vaccinations. I can't remember the wording. I don't know whether you've got it up, Megan, but there is something in there.
Yeah.
What does it say?
Can you hear me?
Yes, vaguely. You might need to just turn yourself up a little bit if you can.
Can you hear me a bit better now?
Still quite faint, but we can hear you. Yes, that's much better, Megan.
Brilliant, that's perfect. So what they have said is, let me just find it on here. A time-limited exemption is also available for pregnant women should they choose to take it. And I've just popped the letter in the chat as well where it says that. It's on the second page and about halfway down.
So Raj, this has put what you would call a slight spanner in the works, in that obviously we're still promoting vaccinations during pregnancy. Obviously, the individual would have that conversation with the GP to ensure that there weren't any other contraindications that they couldn't have it. They would make sure that there weren't any other underlying conditions, concerns, etc. They'd have that conversation with the GP, but we would still be promoting vaccinations during pregnancy. If the GP has signed that off, then that's the conversation they've had, Raj, with their GP. It is as it is at the moment. These things do change, and evidence and data changes. So, but that's only just come in, Raj.
Yeah, so we've given a lot of information to all our staff, and I guess the issue is that if somebody doesn't want to work and they don't want the vaccination, and they use it as an excuse, and like I said, we've got a sick note. It just says pregnant. Without giving any sort of indication of, are they able to work? Are they able to come in and just do some admin work, just even the testing sort of stuff, you know? And it seems like, are we all singing off the same hymn sheet here? If a GP can just sign off somebody for the remainder of their pregnancy, and then they'll get, you know, a year sort of maternity leave and whatever.
Yeah.
Are GPs singing off the same hymn sheet here? That's the query. And I'm not saying that every GP is doing that, but there needs to be some sort of, I guess, guidance all the way up the line to stop people from taking advantage of you know, a government sort of cop out by saying you can self-certify. You've got to have it, but you can self-certify yourself for those stragglers that don't want to have it, you know, because we can all think of a reason why we wouldn't want to have it, but you know, there's 99 reasons out of 100 why you should, and anybody can self-certify. It makes a mockery of the whole system, really.
Yeah, there is guidance that is that has been sent out to primary care, to GPs and so on around the vaccination, so they have received that. I don't know if anybody from health would want to come in here, that I don't know, Mandy or Judy or anybody like that, but certainly guidance has gone out to GPs around this. Did anybody want to say any more around that?
Judy's put her camera on.
Oh, Judy.
Yeah, well, I don't think I can add very much, I'm afraid, Christine. I'm not 100% certain on this, so I'm probably not the best person to comment. I don't know if Mandy and Cheryl have got any more information or had insight into it.
I'm afraid I don't either, actually. Apologies.
Yeah, that there is guidance out to GPs, but we can certainly comments on our ODG group. The ODG is the Operational Delivery Group for Vaccinations. We can raise a query about how GPs are managing this process. I'm sure I shall just get back that there is guidance and everyone knows about it, but I certainly can raise that, Raj, and just get see if I can get further clarification for you.
Yeah, okay, thank you.
That's a pleasure, Raj.
I'll try not to put my hand up again.
Oh no, Raj, please. I'm sure that when you ask questions, there will be people on this call that want to know the same thing as well. So please don't worry about that. Can I check? Is there somebody else from a care home? I'm just trying to work out. I'm going to get my list up and see who we've got and just ask somebody. Oh, we've got somebody else. Who is this, Megan? Who is this?
We've got Raj. Raj, do you want to come in? You're on mute at the moment, Raj. Raj Bari?
Yes. Hi, Kristen. Hi, Megan. Yeah.
Hi, Raj. Hi.
Yes, I'm Raj, different Raj. Okay. So.
Yes. Hi,
Right.
Raj.
Yeah. Thank you. You know that vaccinations for people coming from abroad. Yes.
Yes.
This doesn't give you this. It simply said they have to set a letter to be signed. No, that they exempted from that. But is there a clear list of which country they come from and they have to do it? Because I have a staff from India, right? Okay.
Yeah.
And they've got double vaccinated now. And
Yes.
that country actually produces vaccines also for a lot of overseas. Yeah. So would that be classed as exempted and they can just sign it? Yeah.
The information is in that self-certification guidance.
I couldn't see it. I had a quick browse through. No, it doesn't really say anything.
Exactly. It's very unclear. It just means that people can be exempted at the moment from if they've had vaccines abroad. So I can certainly bring that up with our vaccination group and see if there's going to be any further clarification around that. So these are vaccinations from India. Do you know if it's AZ they've had?
I don't know. I need to check up. No, I know definitely had two vaccines. Yeah. I don't know which type it is, and also obviously.
No. The government have said that they are going to produce more information on this. I think this is a temporary holding statement at the moment. But we can certainly seek further clarification on that. I'll definitely go back.
I think one of the issues that we came across was that many of the vaccines are the same or similar, but rebranded in different countries, and obviously.
Yes.
We don't know.
Exactly.
We say, is it an AZ? Yes, it may well be, but it might be under a different licensed under a different brand.
Yes.
And obviously, every country has their own branding and whatever, and want to claim it as their own national vaccination. And it's very difficult for a layman like ourselves to actually tell. And in terms of the self-certification, how long does that last for?
We don't know.
Also, when we're having booster vaccinations, are the local sort of GPs or the vaccination centres going to be able to say, oh yes, you've had this one in the Philippines and now you can have this booster and it's safe to have the mix and match? And it's going to be a very, very challenging time for those people that have had vaccinations overseas, because we simply don't know.
No, you've made some excellent points there.
And the other thing, Christine, is that they may have vaccine in whatever make they had. When we're gonna start getting the boosters, would that be any problem with that? No, yeah, that's another thing I just need to clear out here.
Okay, so boosters were on there. This is on the actual agenda, which we'll come to later. But yes, the booster campaign is slightly separate. So I want to just keep that separate, if I may, and deal with all the information around the booster campaign in a short while. I just really wanted to clarify everybody around. To check with everybody that they understand about mandatory vaccinations and if there are any other issues around it, because obviously there's going to be some issues around staff that may not take up the vaccine and the impact that might have on your business as well. Megan has just put in the chat box here, the self-certification lasts for 12 weeks after the new NHS COVID Pass system is launched. And what we don't have is a date yet for that new system to be launched. The wording in the information that's been sent out is imminent, but we don't know what imminent means. It could be tomorrow, could be next week, could be next month. That's as it is at the moment. But anyway, that gives you, it's 12 weeks after the new NHS COVID Pass system, Raj. So hopefully that answers that question. But we will talk a little bit more about vaccinations from abroad and the impact that might have as well when it comes to boosters as well. So can I just ask, we've got Katie Lorraine from iSenior Care. Katie and Lorraine, have you had any other issues that you wanted to raise about mandatory vaccinations before we move on?
Hiya. I think we've only had one slight issue which we did have to raise. We had a new member of staff join us. She didn't have the vaccination. She'd been with us for a couple of weeks and then caught COVID. So
Right.
that then delayed her first vaccination. So we just needed some guidance really that she could have the first vaccination after the period of time after
28 days.
Yeah, so then that would take her second jab over the kind of the curfew date. So
Okay.
yeah.
Okay, so the GPs can actually vaccinate within that period of time, so it can be brought forward. So there, you know, it doesn't have to be 12 weeks. It can be brought forward. So what would be really useful is if you could let us know which GP surgery that individual received their vaccination from, and we can work out whether or not we can get the second vaccination by the 11th of November.
Okay, that's brilliant. Thank you so much. Yeah, we will.
That's okay. That you will. It's really important to remember that the guidance is within 12 weeks, but actually that was brought forward to 8 weeks as well. So and speaking to GPs and the PCNs, it can be brought forward even more, but it's preferable not to if possible, but it can be done. So, you know, how long ago did she have COVID?
The 7th of this month.
The 7th of this month. So she's had a few weeks already following that. I'm sure, yes, give us the details and we'll see what we can do for you. And again, I don't know whether the other nurses involved in the call wanted to make a comment on that. Is there anybody from public health as well that's here? I can't see on my screen if anybody from public health is here that would want to comment.
Christine. It's,
Boyka. Oh, hello, Boyka. Hi.
Hi. Please, could you repeat the question?
Yes. So this individual was COVID positive, and I think it was a couple of weeks ago now, but that means that they would not receive, well, the second vaccination is due by the 11th of November, but if they did 12 weeks, it would take them beyond the 11th of November. My point was that the GPs and PCNs, primary care, have agreed that they can bring forward that 12 weeks on discussion of the need for that second vaccination.
Yes, they can bring that forward. They can shorten the period between the 2 doses of the vaccination. I know that for Pfizer, it can be as short as 3 weeks. So
Right.
it is not a problem at all. Of course, there is evidence that a slightly longer period between the 2 doses enhances the immune response. However, in this particular scenario, it can be shortened. The person will have completed now her period of isolation, and she will have built a natural immunity. So she would have to wait for 28 days before having the first dose of the vaccine, and the second dose can be given 3-4 weeks after the first. This would be up to the GP to advise and to administer.
Brilliant. Thank you
Thank
so
you.
much, Boyka. And that hopefully that's really helpful for you.
It is. Thank you so much.
Great, thank you. And before we move on, is there anybody else from the care homes that have a question around mandatory vaccination for care homes? If not, we shall move on to our next item. I can't see anything, so I think we will. But if anybody has any questions later on and they want to email us, please do so. Our next item was mandatory vaccinations for all health and social care staff. There is a consultation out that is now widening the scope to look at mandatory vaccinations for people that work in both health and different social care settings. And that obviously includes home care, supported living, extra care services, etc. So my question to everybody is, are they aware of the consultation? And if so, do they have any comments they wish to make? Because Norfolk Care Association is putting together a response to the consultation, and we've had some feedback already. So it would be really useful to use this discussion now with any further comments. So does anybody have, firstly, I think, Megan, would you mind popping? Thank you. Oh, thank you, Cheryl. Thank you. Yeah, there we go. There we go. Yeah, that's the consultation. So does anybody have any comments at all? Has anybody filled this in or are looking at it? It'd be really good to have some feedback on that.
We've got hands up from Raj and Ian. I think Raj came in first and then Ian.
Okay. Raj, should we take you first? Yeah.
I was just going to turn the question round actually and ask what your position is on the mandatory vaccine, because you were going to respond to the consultation. What is your opinion on this?
Well, it's not one opinion, it's a collective opinion. And when we went out last time, when we asked providers, it was a little split, and it actually reflected the national consultation. So the view was by some care providers and some registered managers that they were in favour of mandatory vaccinations, where others were totally opposed to that. So it was quite split, but overall we said that more people were against mandatory vaccinations than were for, but they were not against vaccinations per se. They absolutely agreed that vaccinations is one of the best ways of reducing risk and preventing transmission. So,
that's similarly what we found this time round as well. So when we've been talking to people, again, no one is saying as much as, oh, people shouldn't have the vaccination. It's just the necessity of it being mandatory. The main thing that we focused on in this version is the recruitment issues, and any further issues that this will then put and any further pressures on the sector, because as we're all aware that recruitment is such a difficult thing at the moment. We focused a lot on that, and as well the consultation it's much wider than the last one. I think there's something like about 30 questions, so it is really huge, and there's a lot of questions in there about flu vaccinations as well, and if they should be mandatory. And as we've commented on that, we've said it's very difficult to understand where people stand on that without the data. So we've requested for more data to be released about what the current uptakes are. So that's sort of where we are at with it at the moment.
Yeah. So Ian, did you want to come in?
Yeah, I mean, I have actually completed a consultation and sent it off and sent it out to my staff to so they can be aware of it. And I did find a few of the questions a little bit loaded. You know, you've been asked a question, do you think staff should be vaccinated? That's a different question to do you think they should be, you know, it should be mandatory, you know, you know, that's so there's a couple of those sorts of questions. And I guess my other concern is the fact they've chucked in the flu. I don't know if the flu was in the previous consultation.
No, it wasn't.
But you know, flu, that makes it a forever change, whereas COVID, I haven't got my camera on, but I'm crossing my fingers that, you know, at some point in the future, you know, all these COVID temporary things will disappear and life will go, I don't want to say back to normal, or yeah, certainly want to say new normal because I hate that phrase. But yeah, that just then for me is a real concern, because like I said, that is a forever change, and until they make it a wider, you know, condition of employment across more industries, it will hamstring care, because it will stand out as the only job that you have to have a flu jab for every single year. Plus, I think there's logistical stuff around, you know, by the time this consultation ends and they make the decision, and to be fair, my personal view is the decision's already been made. You only have to look at the statement made by the minister when she actually launched the consultation to know her views. But you know, we'll then be in the middle of these booster jabs, and will it be the case of actually you've got 2 jabs but you haven't had your 3rd, so you're not, you know, we'll be in the middle of kind of flu jabs as well. And you know, is it going to take flu jabs away from the people who need it more than, you know, more than staff? Yeah, but yeah, they're just a selection of my views, but I'll kind of rein it in and let someone else have a go.
Thank you, Ian. Thank you. That's really helpful. Mark, you've got your hand up. Mark Pepperell.
Yeah, actually, I think the gentleman before us just sort of brought some of it up. What I was interested in, we talk about the vaccination, but of course it is mandatory for flu and COVID. If it's going to be mandatory for one, it will be mandatory for the other. And just as a point, we had someone talking about pregnancy earlier. It is a very loaded. This is really a statement. Do you agree with us, rather than a consultation? And it very clearly gives a lot of loaded evidence that pregnant women should have the flu vaccination. Yes. So does it then follow that they would then have to have one? Could people have one and opt out of the other? For me, I would like to see it as mandatory, but I can foresee there being problems when staff, particularly key members of staff, refuse to have it for whatever reasons. And then before we start going down a mandatory route, what we really need is from people like yourselves. It is an information and an education sort of process, isn't there? So that people aren't making these sorts of decisions in an uninformed way.
Yes.
Because I think that's the worst thing. If we start to lose members of staff through attitude rather than genuine beliefs, because I can live with somebody who has a religious belief maybe, or a philosophical belief, but not just because of a poor attitude and said I'm just not going to do it. So we need education before we have a consultation and before we make anything mandatory.
Thank you, Mark. Thank you.
We do have. Oh, sorry.
Yeah, go on. Sorry, go on, Megan.
I was going to say we do have a number of Q&As on our YouTube as well, where we've from Norfolk and Suffolk Care Support, where we've focused on providing that information. So what I'll do is I'll pop those in the chat as well. So if anyone has got hesitant staff, do feel free to pass those along to them.
Yeah, we had one recently, Mark, as well, where because the date was coming up for that first vaccination for mandatory vaccinations in care homes, we were trying to pick up those people who were still hesitant. And also, like you say, it's about making decisions on the basis of proper data, good data from reliable sources. So ultimately, we're not going to change everybody's views, and like you say, Mark, you know, sometimes that's their decision. If they want to make it, that's their decision. The law now will say you can't work in a care home from the 11th of November if you haven't had both vaccinations. So ultimately it will be their choice. But what we're trying to do is provide the best data, the best information, and from the best sources, the most reliable sources. So you'll see on the YouTube, Boyka from Public Health, who provided recent research, data, information, so that people can make those informed decisions. But also what we wanted to do was make sure that it was a compassionate conversation and not a coercive conversation, because our view is that it's better that people come to that decision themselves than are forced to. That's never going to work. So absolutely take your point, Mark, about ethical views as well. We won't change everyone.
And I think the advantage is, of course, everything that you've done within care homes is almost certainly going to come into the wider sector. So we've rehearsed the arguments, you've already got put into place the education, and you've come across the the people who are rejecting it, and hopefully we're going to be better prepared and not lose so many staff. At the moment, my guess is if we've lost staff from care homes, they may have moved into another sector. But of course, if it becomes a wider social care sector, then we could lose them altogether, and that would be a shame.
Absolutely, Mark. And we do know that actually some people have moved into home care, and we also know that people have moved into health as well. And obviously this consultation covers all sectors, health and social care. So basically it's just pushing the ball down the road for a little bit longer, and until we know the outcome of this, which I think is the end date the October the 22nd, Megan?
Yes,
yes, it's October the 22nd. We'll know after that date. There's usually a little hiatus between that and when they start providing the feedback from that, like they did with the last consultation. But I should imagine that we'll know either end of October or beginning of November the outcome of that. So has anybody else got any queries around that at all, around this consultation? I would urge people to look at it and to respond to it. We're picking up your feedback and making sure that we've got a collective view, and we're more than happy to share that. Well, we'll produce it and share it with everybody before we submit it. So that if people want to add to it, we can do. It's like Megan says, it is quite a lengthy consultation, and it does ask questions specifically about the flu, about the vaccination, almost separating them out, and it is quite complicated going through it, because sometimes it asks for health, sometimes it asks for social care. So it is, I just warn people that haven't seen it, is quite lengthy. But very happy on behalf Norfolk Care Association, on behalf of all providers, are prepared to put something together for the whole sector, picking up people's views. And what Mark has just said actually reflected very similar to the conversations we had with care homes, where some people absolutely agreed with mandatory vaccinations and others were not so sure, but absolutely agreed. I think it was near 100% agreed that there should be vaccinations.
We'll put a draft of our response as well in our October newsletter for NorCA. So if anyone wants to send any comments on after that, you're more than welcome to.
Brilliant. Thank you, Megan. That's fantastic. Okay, well, I can't see anything else in the chat box. I haven't got any other hands up, so we will move on. And I think the next item that we were going to look at, bear with me, it might be the
access to vaccinations.
Access to vaccinations. So I just wanted to check with everybody that they know exactly where to go. So if you've got new staff, or you've got staff wanting to get vaccinations, that you know where to go. So Megan is going to pop into the chat box the place on Norfolk County Council where you can go, and it will provide you with all the sites across Norfolk where you can get your vaccinations. So it's up to date, it's kept up to date. It also includes walk-ins and all of those as well. So it's well worth knowing about so that you can direct your staff to that site. So yes, so thank you very much. That's in the chat box there. We will make sure that all of these links are in the notes that come out to you as well. Was there anything anybody wanted to mention about access to vaccinations? Is everybody okay about knowing where to go? Is there any other queries on vaccinations? I'll just hang on for a moment in case anybody has anything. No? Okay, fine. Then we shall move on.
Sorry, Heather's just put her.
Oh, Heather, do come in, Heather.
Hi there. Yeah, just one question I've got really on the boosters. Are our staff going to be automatically called in, or do they need to look to get the booster vaccinations?
Right. Okay. So that was our next item on the agenda, which was the boosters.
Okay.
Yeah. No, that's absolutely.
I'll leave you with it.
Yes, that's absolutely fine, Heather. So I don't know whether anybody here on the call wants to take up this booster issue, but what I can do is I can provide some information which should be going out to providers shortly on this. Oh, Mark, you've got a question before I move on. Reflu vaccine, we've done a deal with our local Boots and they've booked us out 2 days. So we have offered it to all staff and hope that the fact that so many will take it up helps peer pressure. Brilliant, brilliant, Mark. That's such a fantastic idea. Yeah, and Gemma said, excellent, Mark. Last year, one of the care homes in Great Yarmouth did exactly the same. In fact, they worked with an online pharmacy, it was, and they came into the care home and did the vaccines in the care home. And so they maximised the uptake of the flu vaccine by doing that. So I think that's a really, really good idea. Fantastic. I'm just going to open up the email that I've got that explains a little bit about the vaccine. So bear with me whilst I do that. Here we go. So this is what I've been given. There may be some tweaks to this, but this is what I've been given. And then please, my health colleagues and public health do come in. It says, you will be aware of the announcements that care home residents and care workers will be eligible for the COVID booster vaccines 6 months after their second dose. I wanted to let you know about the plans in Norfolk and Waveney. Our immediate local priority is to provide boosters for the oldest patients, others who are clinically extremely vulnerable, and health and care workers. As before, GPs will make arrangements to vaccinate care home residents and any staff who are present at the time when the boosters are given. GPs can at the same time give first or second doses to residents or staff who have not yet had these. GPs will also make arrangements to vaccinate care home residents for flu during this period. And although the flu vaccine can be administered at the same time, this may not be practical. And your GP will advise on local arrangements. Our NHS colleagues are finalising locations for the delivery of boosters in the community for care workers who are not vaccinated at care homes, so that our NHS colleagues can arrange for staff to be offered the vaccine and so that we can monitor take-up and send reminders. We'd be grateful if you could upload an updated staff list to us. So there will be a template which has been shortened since the last time based on experience and will be sent out to you. We will shortly make the portal available again for it to be uploaded. This time we're asking for you to request NHS numbers from staff so that the NHS can match data accurately with their records. Under UK GDPR, your organisation will remain data controller for the personal information that you share with the purpose of enabling staff to be invited for the vaccination by the NHS. Norfolk County Council will act as data processor to coordinate this information and ensure secure transmission to the NHS. The County Council, the NHS or both will send invitations and reminders and generate statistical data which will not contain personal data. Statistical data may be shared or published. The County Council will not process NHS numbers other than 1 to store them and 2 to transmit them to the NHS. Norfolk County Council will act in accordance with its responsibility as a data processor under UK GDPR and also COPI. We or the NHS will message all staff whose details are uploaded to us to encourage them to take up their booster, and this message will also act as evidence of eligibility. So that's the information that you will be receiving shortly. Now, I have seen a number of comments in the chat box. So Heather's put in here, is it 6 months after the second vaccination for the booster? Yes, it is. And this is why it's complicated in terms of the rollout of the booster, because people will have received their second vaccination at different dates. So this is why it's quite complicated. I've been texted today with a link via NHS to book vaccine, all booked in now. Sandra, that's brilliant. I'm just going to give you a big thumbs up for that. Fantastic. So that explains the process, and there will be a template coming out for you to complete as providers to ensure that you can get your staff on the system so that they will be called and it will be evidence. Caitlin, I have staff already being contacted for their booster vaccine and they just need to book the slot. Brilliant, excellent. So this will be because that information is stored within GP's systems. There's something called Foundry, the systems one. I don't know which system they'll be looking at, but they will know when your staff have had their second vaccine and will call you in. Raj.
Just a quick question. So staff that have had their first and second vaccine that don't get their booster, how does that affect them in terms of the legislation of mandatory vaccinations? I mean, does that come into, if someone's changed their mind, so no, I'm not, it's over now, I don't want them back booster, how does that work?
I think I'll have to check with Boyka on this or somebody else as well. But I think in the mandatory vaccinations, it includes boosters.
Right.
But I need to check that, Raj. Does anybody else on the call know? Because I do understand, Raj, your point here, which people just get weary of it all, don't they? And think, well, we've done that. So let me just see. Is there anybody from our health colleagues that could answer that question?
Christine, if I may, I don't think the booster is included at the moment in the mandatory vaccination, because the booster have just been approved, the booster vaccination about a week ago, and the mandatory vaccination legislation was preceding the boosters.
Sure.
Also, because there needs to be a 6-month gap after the second dose for the booster, many health and social care workers will not have this time elapsed before November. So I think I also will need to check the latest communications. However, my view at present is that the mandatory vaccination applies only for the first 2 doses, but not for the booster. So this is as of today, but I need to check.
Yes, Yes, exactly. That's why I hesitated, because things change all the time, don't they? So we'll check that out. But as Boyka says, it doesn't look like it's in the guidance at the moment. And so Raj will keep you informed, because we're very aware that things come out, you know, when we're least expecting. So yes, Cheryl says this is also my understanding. Okay. Yeah. Okay. Fantastic. Yeah, thank you.
Mark has just popped something in the chat slightly earlier as well, Christine, saying there was some talk about the type of booster. Logistically, it's slightly harder if they had to take the 15-minute mandatory wait. Do we know what type of booster they are using?
Yeah, Boyka, did you want to come in here?
Yes, the government announcement by the Chief Medical Officer and the head of the Vaccination Committee was that Pfizer mRNA vaccine will be used, 1 dose of Pfizer, or another mRNA vaccine, which is Moderna, half a dose of Moderna. So these 2 vaccines will be used for as boosters, as the majority of people in UK received AstraZeneca as a first and second dose. So for the booster, for the third dose, Pfizer or Moderna.
Yes, yeah. Is that okay, Mark? I just want to make sure that, yeah, brilliant, fantastic. Okay, all right. So yes, as I say, that information around the booster will be coming out to you, and a template to complete. Caitlin, come in, Caitlin. Are you able?
Yeah, sorry.
Yeah, no, we've got Caitlin here. Go on,
it's
Caitlin.
Tracy, actually. I've put Tracy.
Oh, Tracy. I've done it again. I've read it the wrong way round. I beg your pardon.
That's
Tracy.
Fine. What I was wanting to ask is, with the Pfizer and the Moderna boosters, how are they going to be rolled out in care homes for those? Because the reason they didn't have the Pfizer in the first place was because of how they were having to manage that with the temperature. So has that changed?
It has, and I'm going to get Boyka to come in and explain the slight changes in that, if you're able to, Boyka.
I'm not able, I'm sorry, to explain the logistics, how the GPs and NHS are going to work the practicalities, but I know Pfizer needs to be stored at a very low temperature, but then it can be taken out of the fridge for a particular number of hours. It is safe to be out for a particular number of hours under normal fridge temperature, and I'm sure the logistics and cold chain will be strictly organized by the GPs and health workers. So care home providers do not need to worry about this aspect for it.
Okay, that's lovely. Thank you.
Thank you. And thank you, Tracy. It's a really good question as well. And it was one of the big issues, wasn't it, Tracy, at the beginning, where access to Pfizer in care homes was really complicated at the beginning of this of the first vaccination. Yeah. So it's an absolutely valid question. So thank you for that one.
Thank you.
Is there anything else anybody else has got around the booster? I think Raj, both Rajas, you mentioned about which booster would people need if they've had the vaccination abroad. I don't know. I'm really sorry, Boyka, to bring you in, and you may not know, but do you know what might happen with somebody that's received a vaccination abroad, and what type of vaccine would be given for the booster?
I think there is not yet official communication how vaccinations abroad will be recognized, and how this will be reflected on the NHS COVID app, COVID Pass. I think we're still awaiting confirmation of that, and boosters will be decided on an individual level, depending on what the individual has received in the past. I know generally, as I said before, that Pfizer and Moderna have been approved as boosters here.
Thank you. Yeah, thank you, Boyka. So I think it's a question, Raj, of we'll just have to keep looking for further information and raising that with our ODG, the operational delivery group as well. So we will do that. But thank you for the question. Is there any other question around boosters that? Oh, here we go. Sue, is there any update on what happens after the furlough ends on the 30th of September, and will day one of statutory, oh, I keep missing it, it's going, SPP still
Statutory
apply?
sick pay, I think that is.
Do you mean SSP? Yeah, okay. Sue, did you want to come in?
Sue has put SSP in the chat. Sue, can you come in and turn your mic on, or if not, let us know.
It's not a question I could actually answer here without going to do some investigations and research around that. I'm just not clear what the question is there, really.
Sue's saying her mic isn't working, so.
Okay, Sue. I'll see if I can. I don't know if Stephen's come on, Stephen Long, if he's back on, if he's on at all. Let me just see. Is there anybody on the call from local authority here? I was just looking to see. I don't think Tim can be with us today. No. What I can do is I can bring the question to Tim Weller and see if Tim Weller is able to answer, because that's a HR type legal question, which I think we need to just clarify for you. Is that okay, Sue? We'll do that. We'll take that away from this meeting. Okay, brilliant. And we've got some comments in here from Boyka around the recommended boosters, and we've got Cheryl's comments around regarding boosters for people working in care homes. Booster doses are not currently included in the regulations, but managers are strongly advised to encourage workers to take up booster vaccines if eligible, and a provision for booster vaccines may be added to the regulations in the future. I think that's where I saw it. It's the added to the regulations in the future. I've read something around that, so thank you for that, Cheryl. We've also got, what have we got in here? Day one remains in place for COVID. I'll find you a link. Okay, oh, Heather's come back with some information, so thank you, much appreciated. Oh, good. Okay, and Mark, this is slightly off field, but do we have anyone from NCC here, as we always paid our staff 30 minutes for the initial vaccinations, and could staff payment for boosters be a legitimate claim against infection control grants? We can certainly ask that, Mark, to Suzanne Baldwin. I'm very aware that the Infection Control Fund is ending shortly, and I'm not sure if that provision would still remain. So it's something that we do need to clarify with them, because I believe that money has come from the Infection Control Fund. So we would need to check that, you know, what might happen in the future, Mark. It's a very good question. Oh, here we are. Heather, what does this say? Heather, do you want to come in? We have updated the
yes,
guidance.
Yeah, it looks like I hadn't seen this actually, but it looks like the guidance was updated on the 9th of September to say that it does actually end, that the COVID from day one, SSP from day one, does end at the 30th of September. So, you know, I'm in payroll and I hadn't actually heard that. So that's been, but that has been updated, and I put the link there that people can go to get that information.
Thank you, Heather. Thank you. That's really helpful. Fantastic. Yes, paying staff always helps. Yes, it does. It does encourage. And if people can't get it on site, it's very different if you're working in a hospital or somewhere where you can go. It's your place of work, but where you're actually asking people to go a distance sometimes, then yes, it was recognised that paying people for the time would be an incentive. So it's a very good point, Mark. I will bring that up with Suzanne to see whether that's still possible given given the infection control fund is winding up. And Raj said we pay £10 for time and travel for each vaccination. Yes, I'm sure. Yes, absolutely. And it is it's an incentive, isn't it? And it's time, isn't it? It's time and resource. So we've got Rianne coming in here. But yes, I'm happy to take that back to Suzanne Baldwin. Okay, was there anything else at all around boosters and flu vaccinations as well? No? Okay, well, we will move on. The next item I have got, before I do move on, can I just ask Mandy and the Q&I nurses and Gemma, is there anything else that you wanted to add about the boosters and the flu vaccinations that I haven't covered?
It's Mandy here. I can't think of anything, Christine. I think it's covered very well, actually. And I think that's about as much information I have to hand, so nothing to add. Anything from your point of view, Cheryl?
I don't think there is anything to add, and I think Boyke has gone off the call now, but I think for anyone who did have a risk of an anaphylaxis to the Pfizer, for example, they will look at potentially AstraZeneca, but that will be done on a very individualised basis, from my understanding.
Yes, that's right. Yes, and again, those kind of individual discussions you would have with your GP or the person that's vaccinating. But it's a really good point, Cheryl, to highlight. Thank you.
If I could just jump in, Christine.
Oh yes, Gemma. Yeah.
The flu meetings are just starting up in the system at the moment. The Knowledge Anglia flu resources have all been updated for this year's flu season. So if everybody would like to have a look at that and make themselves familiar, and if they have any issues at all accessing flu for either their staff or their residents, if they could please email the generic care provider nurses inbox to make us aware, and we can support you with that too. Thank you.
You. Is it possible, Gemma, that you could just pop the email address in? And I'm just looking at Knowledge Anglia as well. Have you got a link? I can try and get one myself.
Yes, I'll put it on now, Christine.
That's great.
I've got it to hand. I'll slip it in for you.
Oh, thank you, Mandy. That's very kind. I'll just put the care provider nurse's email back in there.
Fantastic, because one of the things about going to the Knowledge Anglia site is sometimes it's not clear exactly where to find these things. So a link would be really helpful. Thank you. And again, we can send that out to everybody. Oh, Mark, you've got your hand up. Yes, come in, Mark.
Yeah, just before we finish with the flu stuff, there were reports, weren't there, that there were either logistical problems or shortages of the actual flu vaccine. Have you got anyone there from health that can tell us whether or not that's old news and whether or not there is going to be a full supply? Because we could be having an argument here about something that we can't even deliver.
At the moment, Mark, yes, there has been a shortage. So all stocks that were ordered prior to the 22nd of September will be delivered. And anything after that date, for the moment, they're going to, for equity reasons, shorten the stock across the whole system so that everybody can, I don't wish to say prioritise their priorities, but that's almost how it is. So if you could all be very mindful in that case to make sure that all of your staff and residents' names are down, ready to receive their vaccines so that they can be added to that priority of the priority list, please.
I'm sorry, are you suggesting that we prioritise within?
Not yourselves, no, absolutely not yourselves. You're all a priority, both your residents and your staff. But it's so that you highlight all of that need to the locality so that the stocks can be ordered and distributed evenly. Thank you.
Yeah, and there is a priority rollout. You'll probably be aware that that GPs are calling in groups in order, so to try to to prioritise. Obviously, health and social care workers are one of those priorities. So, as Gemma says, if we can get the information out as quickly as possible, that would be great. Raj, come in.
Sorry, just a quick question with the boosters. Last time with the vaccinations, we had like the GPs come in and they did all the residents and all the staff literally on one day. What we found was that the next day we had a lot of minor but bad reactions, which caused absences and things. How can we mitigate that with the booster? I'm not saying that it's going to cause any adverse reactions, but obviously some people do. I mean, I never told anybody, but I'm telling everyone here. I was ill for like 4 days after my first one and had absolutely nothing after the second one. And I'd actually planned to have like a few days off after the second one, but didn't feel a thing. But after the first one, I didn't get out of bed for 3 days. And obviously we had a number of staff with headaches and fever and whatever, and we need to sort of plan that with the GPs. And I know their priority is to come in, vaccinate all the staff and all the residents, and literally the next day it was a nightmare, you know, trying to find people that were able to come in.
Yeah, I think this is the logistics of the rollout, and one of the conversations on the delivery group was that there is concern about giving everybody the vaccines all at the same time. I don't think this time you'll find that everybody will be receiving the vaccine at the same time, unless obviously everybody has had their second vaccination at the same time. Plus, if there's flu and the booster to give, it's going to take a longer time to do. And one of the issues that one of the GPs was saying was they'll have to come back. My assumption is that this is going to be taking place over a number of days with the GP surgeries. It's just a logistic issue really, because obviously they want to reduce the amount of times they visit the care homes, but similarly they have to recognize it's going to take twice as long to do flu and vaccines together as well. We've got somebody with their hand up. Who's that? Who's put their hand up? No?
Oh, no one's put their hand up. That was just someone coming in. Stephen Long's just entered.
Oh, hi, Stephen. Hi.
Hello.
Yeah, so hi, Stephen. We're just talking about the vaccinations and the rollout. However, what I can do, Raj, is I can raise this at the ODG group as a concern from yourself as a care home, that the timing of the vaccinations may be better spread over a period of time, and just raise that as concerns about staffing issues may arise. I certainly know the GPs on the call are very aware of that as well. It's the balancing act between resources to do it and practicalities, but I can certainly raise that for you, Raj. Is that okay?
Yeah, absolutely. I mean, it's not just the staff, but also the residents as well. If you've
and
got
the residents, yes,
exactly.
And the residents.
The next day, and you can plan to put extra staff on the next day in anticipation. But if your staff are also not feeling well either, it's a double blow, really.
It is, absolutely, and it's definitely something that's been raised. I suspect that it will be taking place over a number of days, because there's 2 vaccines anyway, and the numbers are going to be increased as well. So let's take that back and see if we've got any further ideas about how that will be managed. Is there anybody? Let me see, Mandy, Cheryl, do you have any views on this? I didn't know whether also Judy might have from a primary care perspective. Verma.
Cheryl, no. I think was coming in.
Was it Cheryl? Sorry. Yeah. Who's first then?
No, I don't have any other information, but as I say, I think it would be very appreciated if that's taken back to the vaccination group, because I don't join that, and I think it's a very valid question to be taking back and seeing how potentially how that's going to be managed. That was my only comment, really.
Yeah, that's fine. I can do that. Yeah. Okay.
And then Gayatri has her hand up.
Gayatri, are you there? are you able to come in? Are you on mute?
No, you're off mute.
Am I?
We should be able to hear you. That's funny.
We usually can, can't we, Gayatri? We can usually hear you. There appears to be a sound problem. Did you want to pop your comment in the chat box and we'll pick it up that way? There doesn't seem to be an obvious issue. Oh, Judy's coming back in here. So
yeah, if you pop that in the chat, and then we'll be able to pick it up there.
Yeah. Okay. Okay. So before we just move on, just want to make sure that there aren't any other questions in relation to the booster before we move on. I think it's gone quite quiet now. We'll wait to see if Gayatri will. Oh, here we are. I have a resident who doesn't want to be vaccinated. What can be done? Well, they're exempt from vaccinations. I mean, this is the irony, I would say, of the vaccination programme. They're one of the groups that is part of the exemption. So the only thing that you can do is as with any hesitant member of staff, to be able to try and discuss with them in a really calm and informed way, and maybe to have somebody around them that they trust, that can support them to understand the information. At this stage, it's all you can do. It's about providing the best information in as calm and as simplistic way as possible, and get them to be able to ask their questions as well, and you know, in a non-challenging way, so that you can have the conversation. But they're entitled to not have the vaccine. They are part of the exempt group. I didn't know whether anybody else wanted to come in there. Cheryl, Mandy, Judy, on that point. Yeah, Cheryl.
Cheryl, you're muted.
You'd think after a year and a half I'd be expert at this by now, wouldn't you? But clearly not. Apologies. I was just going to say, I don't know the circumstances around this particular resident, but there's suggestion that there's capacity, but there's a lot of easy read information available. I believe it's on Knowledge Anglia, but I'll check. So if that can support them having that understanding, there are a lot of resources out there to support that, really.
Yes, there's some stuff on Norfolk County Council as well. So I think it was done by Open Doors. So it's quite straightforward, quite useful information to give. So it's less words, more diagrams, that sort of thing. It's slightly easier to understand. He came to our care home only 1 week ago. Yeah, so I think it's about providing that. If they have, obviously, there is the capacity issue, isn't there, Cheryl? You do need to make sure that they have capacity to make that decision. I'm sure, Gayatri, that you've done the Mental Capacity Act assessment anyway, but just to make sure that they have the capacity to make those decisions. Otherwise, you know, you're into, have you done your MCA assessment and best interest following that? But yes, we can certainly get the easy read stuff for you, which we could provide to you as well, that you might be able to share with your resident. Okay, all right, thank you very much, Cheryl, for that. Right, so we're on to now any other guidance that's been brought in recently, and does anybody have any questions around recent guidance that's been brought in? Anything to do with PPE or infection control, anything related to that? I think the most recent one, if I go back up here, is PPE. Changed because obviously certain guidance changed after restrictions were lifted. There's whole sets of PPE guidance that came out and was updated. Infection control for care providers. So it's really just an opportunity for anybody to ask any questions around that. Oh, thank you. That's a link for Knowledge Anglia in there.
Yeah, so I put in the easy read guide and also a guide to determining ability to consent to the vaccination. That's all on Knowledge Anglia, but I've put the links in there as well.
Brilliant. Thank you, Megan. That's really helpful. Thank you. Okay. So has anybody got any questions, particularly around PPE or infection control measures at all? Is everybody okay with those? Have you had any issues with accessing PPE? Anything like that? Please come in and ask questions now. Looks as if everybody's okay at the moment. Just check. Oh, yes, Judy.
Hi everybody, thanks Christine. Sorry, I had to leave to another meeting and then
yes,
come
okay.
back. I just wanted to plug our training. Actually, we were asked by the quality assurance team at Norfolk County Council. I think the capacity tracker identified the need for some sort of additional refresher training really on COVID. And so what we've done, we've pitched it as winter preparedness really. So it's just a reminder on the COVID, as you said, that there aren't any changes in the requirements. It's as it has been. But it was also a reminder and to have people on people's radar for flu and norovirus, because obviously we've been so consumed by COVID. And I had a really interesting stat from Public Health England the other week. Last winter, because of the situation and the lockdown and all the precautions we were taking, there wasn't one confirmed case of flu in a care home in the whole of the east of England. So yeah, exactly. So you know, this winter we are expecting it to be a very different picture. We're open up again as a community. So the training really is nothing new. It's what everybody will, you know, remember hopefully, but it's just that refresher and to just a reminder of the management of the different winter viruses that we see. So it will be, you know, flu, noro and COVID. So we had put on, Christine, thank you for advertising. We're doing it in conjunction with NCH&C, with EC, infection control teams, and the quality nurses from the CCG and ourselves. And we put on, there's a training session every day for 4 weeks, so there's 20 sessions and people can book on. Numbers haven't been great, so what we've done this week, we've condensed it to 2 days, so it's today and tomorrow, and I think Ian's already put and instead of booking for this week, because I think that might be complicated for people at short notice, we've just put the links now. I think Pete has resent that as well this week, so just come if you can. If you get to 2 o'clock this afternoon and think actually I've got a couple of people free, jump on, that's fine. And then we'll review it week by week. We'll review Friday for next week whether we need to condense and just do a couple of sessions and do the same thing then. But sorry, Mark's got his hand up. What did you want to come in, Mark?
Yeah, I mean, I have to be honest, I'm not that up on the changing guidance because obviously that's more of my registered manager's sort of role. However, it's an observation, bearing in mind we got such enormous rates of infection, there appears to be a narrative amongst the populace that it's over, isn't it?
Oh, I know.
I've been in the city recently and I was in our leisure centre here in Dereham this morning and I was the only person wearing a mask. And I want to say to people, there is COVID here. It's in Dereham. We've had it in staff. We've had it in clients. And I'm not quite sure what the guidance change has been. But I know that we've, reading between the lines, it's almost been a back off. And for me, I don't understand that. I think especially coming into the influenza seasons as well, I would like to see masks made absolutely mandatory, and maybe you could tell me if they still are. But we use masks for every single visit, whatever the nature of the call. But I don't feel that that's the narrative that's out there in the general populace.
No, and I have to be careful what I say here. So it's been left for local. So as a local health economy and health and social care partners, we've made the message very clear that for health and social care, masks are still expected. Absolutely.
Yes.
I think there is a lot of confusion. You're absolutely right with the lifting of the restrictions from the 19th of July, then with the lifting of the self-isolation requirements on the 16th of August. So for the general public, I think people are thinking it's not needed. I'll share with you our health partners in the acute trusts having a dreadful time, visitors coming in without masks, and when they're challenged, some of them can be quite abusive. So you'll see some CCG comms messages going out saying, please remember. Same for primary care. We've had lots of report from GP practices, patients just thinking, I don't need to wear it anymore. So the message really is clear. For health and social care, masks absolutely are necessary. And it's those constant reminders that we're going to have to, and it's really hard for staff actually, because they'll say, well, I can go out with my colleagues for dinner the night before in a restaurant, and yet when they're at work they wear a mask, and when they have their lunch break and they're socially distanced without their mask off, and it's because they're in that health or social care setting that the requirements are different. So in terms of infection control guidance for within your care environments, nothing has changed. Your III mask if you're within 2 meters of someone or they're coughing. You can wear the non-resistant ones if you're more than 2 meters away, but be very careful with that. I don't want masks to get muddled up. If you've only got the fluid resistant ones, just keep to that, because if somebody needed you and called you, you've got to think, well, have I got the right mask on? So masks absolutely are still essential.
Yeah. Thank you very much. I'm just popping all the guidance, the updated guidance, which, as you said, Judy, was changed in August following the lifting of restrictions, but much still remains the same. There's only a few little changes in there. Stephen, did you want to come in here, Stephen Long? Because I think one of the issues that we've had with CQC recently with their inspections is that they found that in some care provision the use of PPA is not as robust as it should be. So Stephen, did you want to come in?
Hi Christine, thank you. I think that what the feedback we had from CQC the last time we met as a local authority and obviously as a regulator is that they have seen instances of potentially PPE not being worn as it should. We've also found some examples during our PAMMS visits. So all we can do is reiterate the importance of wearing PPE and following the IPAC still, because like Julie said, COVID is still very much, and like Mark said as well, COVID is still very much around us. It hasn't disappeared, even though from our own personal opinion, obviously going out in the community, it almost seems in certain circumstances seems like people no longer, COVID has completely disappeared. It's no longer around us. But yeah, all we can do is obviously keep working with providers to make sure that they do follow the protocols, but also understand the pressures that providers are under, and that this has been obviously been going on since March last year, and that people are tired. But the importance is still that PPE should be worn in settings, and that protocols should still be followed, because it does obviously safeguard vulnerable people. We have feedback. Obviously, it's been discussed individually, and we're supporting us as much as we can as a local authority.
Thank you, Stephen. Thank you. And we've got here, Sarah says it's one of the problems with leaving your camera switched on. I don't know what that is, really. I don't know what that's. Oh, is Mark Pepperell okay? We think he's having another meeting. Yes. Okay. Sorry. Actually, Irene, I know you're here today. I know you said you'd be in the background, but did you want to come in, Irene? Because you put something very useful. Oh, hi, Irene. Hello.
Hi, Christine. How are you?
Hello. I'm fine, thank you. You've put something in here which I think is really interesting.
Yes, I just wanted to update on the symptom-free testing. So, as you know, that all visiting professionals to care homes are using LFD tests, your lateral flow devices, but Norfolk and Waveney are moving over to LAMP, which is a weekly test, and the guidelines and the clinical evaluation of LAMP have been published. However, they haven't referenced that LAMP is a weekly test, which is causing some issues for visiting professionals to care homes. So until the visiting professional guidelines is updated to reflect that LAMP is a weekly test, Kat Byford has written a letter for care providers that hopefully you could publish, Christine. And this is only an interim letter till hopefully the guidelines will be updated to reflect LAMP. So visiting professionals may use LFD tests or they may use LAMP. But I think the 3 acute hospitals have moved over to LAMP. EC and NCH&C are just moving over, so you will see a lot more people using LAMP. Primary care will start moving over at the end of September. We're nearly there, October time. So you might see more primary care staff also using LAMP.
Yeah. Okay, Irene. So we haven't received the letter yet, and as my understanding is, it's going through NCC comms. So as soon as that's been signed off through NCC comms, we'll get that letter out. So I think at this stage, it's just a sort of be prepared. You'll get a letter very soon coming out. I'm not certain what date that will be, whether it will be this Wednesday, but this is really just to raise awareness that this will be coming out. I think that are you aware, Stephen, of any dates? I'm not sure myself.
No, not aware at this moment in time, but I can find out.
Yeah. Julie's put a little question in here. Can you still test within 90 days of having COVID? Irene, did you want to come in here?
That's a really good question, Julie. With LAMP, it's 14 days. So staff that test positive. So with LAMP, you don't need a confirmatory PCR test. That's the beauty of LAMP. But they can start retesting within 14 days. However, due to our variants of concern, they are asking anyone with a positive test to have a PCR for sequencing at the moment. But they will be all retesting within 14 days.
Yeah, there's a question in here that I suppose this spins out now. Will care home staff be able to do this? At the moment, we haven't got that guidance, but Irene, are you aware that this might come in?
So the LAMP is just commissioned for NHS commission services and staff at the moment, because it is quite new. Yeah. And the NNUH were the first place to pilot this LAMP. So that's why we're the first area to roll it out. The idea in time that it will be rolled over to maybe education and social care, but obviously they have to do the full tests and make sure it's rolled out properly, and that we have enough workforce to manage it before we roll out further.
Thank you. So in terms of anybody else doing tests, the 90 days still is valid?
So 90 days for the LFDs, PCOs, but for LAMP, if they just do their LAMP, that's 14 days.
Yeah, I just wanted to make sure that that was clear in case somebody just thought, Julie, this is definitely 90 days is still okay. Can you still test within 90 days? The guidance is you do not need to test within 90 days. In fact, it can give you inaccurate results. So it's advised not to test within 90 days if you have had COVID, if you're positive. Within a LAMP, it's a different situation. I've got somebody else coming in, and I've got Mandy's. Mandy, did you want to just come in on that first before I go to Caroline?
Yeah, just on that note about within the 90 days, having sat through sort of outbreak management team meetings with some providers, our public health colleagues would emphasise that the exception to that rule would be if the person has presented with new symptoms. Would that be correct? Yeah, I'm getting a few nods there, so just to throw that one in the pot.
Okay, but they would be advised about that, wouldn't they?
Yes, indeed. Yeah.
Yeah, that's great. Okay, thank you. And then Caroline, and I think after Caroline's question, we're going to have to end the session because it's 11:30. So Caroline, did you want to come in?
Hi, Christine.
Hi.
You know, in November, we've got to see the proof of the NHS Act for people coming in, and the email or the text message from the .gov with the LFD registration.
Yes.
Will the LAMP also have those, the government emails?
That's a very good question. Irene, do you know? Oh, you're on mute, Irene.
Of course I am. They will have a text message and an email, and it will come from a national platform, but it may not have government kind of emails attached to it. But all the data from all this, every test that we do, whether it's LAMP or LFDs, any testing goes through the government portal, and then that data is sent back down. But I think they use a platform called Lantern, and all the visiting professionals will have a text message from this platform or an email address or an email of evidence.
Okay, lovely. We're still having issues with community nurses turning up to want to come in and treat some of my residents. Last week we had 3 turn up, none of them had an LFT result. So as a result, 3 of my residents suffered because the nurses haven't done it, and they know, and I've even supplied them letters.
Caroline, I think we really do need to take this up. If you could tell us where, or if you could email us offline, Caroline, with the practice where these nurses are coming from, I will take that up with their PCN lead.
Okay, Christine, lovely, thank you.
Is that all right, Caroline? Because this should not be happening. I'm sure everybody, Judy and Irene and everyone on the call would agree. Judy, did you just want to come in?
Yeah, I was just going to say, are these community nurses that might not be from general practice? They may be from NCH&C or EC.
They're through the single point of referral.
What locality are you?
I'm in Watton.
Okay.
Oh, right. Okay.
So if I put my email address in the chat, can you send me the details? Would that be okay?
I will, Judy, yeah.
And Judy, you and I, if we keep in touch around this, because that's really important, we follow that up. Caroline?
Yes, it is, because like I said, my residents they're losing out on care that they need.
Absolutely, absolutely, it shouldn't happen. So thank you for raising this, and we'll make sure that we get through to the right people to get this corrected.
Thank you both.
Thank you. Well, we are at the end of the session today. So I just want to say thank you very much for attending. We will make sure that all of the questions that have been raised today, we will get those out to you with the answers. We'll pick up the questions that you've asked us to take through to the operational delivery group and vaccination. And we will share the information with our public health colleagues as well, and make sure that you get the information out as soon as we can. So if anybody has any further questions or would like to raise any other issues, please email us, and